Hi, my name is Rob Steven. I'm the Managing Director of Covoya Specialty Coffee. We're here today in the community of La Fuente in Guatemala. As you can see behind me, you see a number of families receiving medical attention at a clinic that we sponsor, as well as we're going to show you some work that we do in Ayarza near our cherry mill with a similar set of services. And we'd like to show you a way that you could be involved in this work to help support coffee farming communities.
Here at the Blue Ayarza Cherry Mill, we do lots of different things. First and foremost, we buy coffee cherry. We pay for quality cherry, process it as good as we can, and produce very good products. But beyond just the coffee business of buying coffee cherry, processing it well, and selling it to various markets, we also see that there are people behind that coffee, and people have needs. One of the needs that we've seen in this community is there's a lack of health services provided. So seeing this need, we've been able to fund a clinic here that is year-round. Mondays and Tuesdays, we're open for walk-ins. Anybody in the community can walk in, pregnant, sick, old, young, they can walk in from the community here. Wednesday, Thursday, Friday is all community outreach. So this is visiting people in their houses, community trainings on how to better take care of yourself. There's a new hand washing initiative, among others.
Y siempre he venido aquí cuando hay consultas y yo siento que sí nos han ayudado. Aquí yo vine porque yo me sentía mal de la vista y me dieron unos lentes. Y yo sí que sí me ayudaron.
Pues para mí es una gran ayuda que esta clínica haya venido aquí, porque anteriormente los tocaba que ir hasta el hospitalito, ¿va? En vez de no tiene vehículo y todo eso, ¿va? Y caminando, pues a pesar de que va uno enfermo, llega más enfermo, ¿no? Allá. Entonces para mí es una gran bendición, no solo para mí, sino que para toda la comunidad.
Y yo me siento contenta con el beneficio que nos están dando aquí en esta clínica, porque yo he venido aquí por el problema de la presión. Y sí, gracias a Dios me han atendido bastante y nos han ayudado a nosotros, mujeres, niños, embarazadas, todo tipo de personas.
Yo vengo de aquí en Manzanillo, gracias a Dios esta clínica los ha ayudado, porque siempre mis niños ellos seguidos se me enferman. Yo seguido los traigo aquí y vienen a sacar del tratamiento que les dan.
Es un gran amparo que tenemos aquí con ustedes, porque yo tengo unas nietas y aquí ven con toda confianza y en la fe de Dios que...
My name is Edgar Dominguez. I'm a medical doctor at Funcafe. We have a nurse who works directly in the community. She really tried to give knowledge to the people about the basic things they may do to prevent illness and to keep her health. We can help people to have access to medical benefits, to families to save money. So we are really thankful to OFI to take this challenge. We try to think about an effect that may help to change the outcome of the total generations.
One of the biggest challenges found in Guatemala is actually malnutrition. So it's very well documented that children in Guatemala, for various reasons, are some of the most malnourished in the world. So it's often that we find with the health clinic here, kids that are underweight and undersized. And so when that case is discovered, we refer them to the local clinic, we get them vitamins, get them supplements, and give them the follow-up to hopefully get them out of a malnourished state. Welcome to La Fuente. La Fuente is a small community in the Oriente region near Ayarza. So this is a small community that was, you could say, discovered by our social worker, Carla. She's really been one of the protagonists here. She found this community, discovered how special and how unique it is, and also how many needs it has. This is a community that oftentimes lives with very limited access to water, basically no power, and very limited access to other resources like a middle school or like proper height and weight measurements for their kids. Through the support of Covoya, through the support of other donors, we've really tried to have a large impact in this community. So some of the projects have been coffee kindergartens. So while the parents are harvesting coffee, the kids can be here learning about school. There are programs like the ECMS, the extracurricular middle school, which is a pilot we're starting this year. For that lack of middle school, we've created basically a middle school class within this that's after hours so that those kids can continue studying. There's Chispudito, which is a vitamin supplement which is being given to over 150 kids here every month to improve their height and weight. And the initial results after the first 2 or 3 months have been very positive. Kids not only growing centimeters, but also gaining weight.
Estamos muy agradecidos por las donaciones que nos han venido brindando durante el tiempo. Ahorita estamos con ese agradecimiento grande, con este beneficio para los niños desnutridos, la ayuda que viene para que los niños puedan tener sus vitaminas y en poder estar ellos con un mejor rendimiento escolar aquí en el establecimiento.
We've engaged more and more with the community. With the support of Covoya, we put a cement floor where there was a dirt floor, put in doors and windows, and an adobe brick schoolhouse that the parents built 40 years ago, and it had been like that for 40 years. We just received more support for some new chairs. This is a community that really not only has needs, but is also willing to do the work and show up and improve the education of their children.
The name of our company is a combination of two words, collaboration and voyage. And those are two words that are very important to us. We believe that coffee is a collaborative voyage, and what that means in practice is that success really only counts when it's shared. So in order for us to really fulfill our mission, we need to be creating success stories with everybody that we work with.